how to find the ideal TRT protocol for someone. Should I start with cream or injections? How frequent should I apply the cream or inject the oil? And how to determine the best dose to start with. So a lot of questions, but for someone that is beginning, it's all a bit complicated.
Yeah.
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Being a dermatologist, I recommend Mizumi skincare products for all acne-prone skin. Link in the description of this video.
Yeah, it's remarkable. I mean, I saw that question you asked me. I said, well, that's the easy one. I don't have to review that one at all. Just talk off the cuff because I've done this for so long. All right, so that's easy. It's individual. So again, the gold standard that I've been used to for the longest period of time for hormone optimization therapy is injectable. You know, IM. Been around forever. Still considered the gold standard. There's none of that, but it's easier to measure. The serum blood levels are more reflective of your IM protocol than would be your transdermal protocol. We discussed this before. Transdermals are best measured by salivary hormone testing. We don't do that. It's not gold standard. So I always recommend, if a person is not needle phobic, I always recommend go to injectable. IM first and foremost. If they're hesitant, needle phobia, I say, well, try sub-Q. You know, sub-Q is less invasive, hurts less. But then I get feedback, constant feedback from the patient, whether they're getting dialed in or not. So it's the feedback, the symptomatic feedback I get when I follow up with these patients, whether I need to keep them on IM once a week versus twice a week versus thrice a week versus every other day or every day. It's just feedback. It's just trial and error. Just try these different methods. Tell me how you feel. Now, I look at labs too, but you know, most people right now, I rarely start somebody on injectable once a week now. I pretty much start them on at least twice a week. You know, more steady troughs and peaks. But then sometimes, you know, I have to go to every other day or every day. Then I'll move that person, you know, to creams if they're needle phobe, or they may be one of those people that has to feel that DHT to get a better libido or, you know, feel better about being a man. So they need higher DHT. And I just base that on how they feel and their compliance rate. Now remember, compliance is an issue. So I find with transdermal that rarely do I have a guy that's really, really locked into discipline, meaning they're going to apply it every morning and every night. There's always people that they just miss a dose here and there. So I tell them, listen, it's on you. You want to feel better, you got to be compliant with the dosing regimen. So I use compliance. I use feedback as far as symptom resolution, as far as which method I want to go with. I prefer IM at least twice a week to start. You know, I think that we as docs tend to start a little too high sometimes. A lot of people start like, you know, 100 mgs twice a week or 200 mgs a week. And that's the high side. I find that the TOT testosterone optimization therapy light, meaning 50 mgs twice a week, can dial in 80 to 90% of my guys. And guess what? They're telling me it works. The labs are fine. I get guys 800-900 at the trough of that regimen trough. Now remember, if you're gonna do 50 mgs twice a week, your trough, if you inject Monday and Thursday, your trough is be Monday morning before you inject it, or Thursday morning before you inject it. So I find most of my guys hover right around 750 to 850 using 50 mgs twice a week as a trough. They feel great. Adam questionnaire are resolving, you know, feeling more libido and better sex drive and stronger erections. But so again, compliance, lab values, and how the guy feels. Again, so if the guy's a needle phobe, some guys just tell me, Doc, I'm not going to start needles. Don't think about needles. I can't put a needle in me, so I'll just go right to transdermal.
Mm-hmm.
Now, what's the least effective way in my method? In my opinion, it's better than nothing. But the old pellets, it's better than nothing. But we treated cattle with pellets, but they can't talk to us. And to me, it's a lazy doctor's method of using it, because you get in the guy, and if you overshoot, you undershoot. Sorry, buddy. See you in 4 or 5 months when I got to put them back in, and we can adjust it then. So again, Dr. Neil Rozier, he was talking one time, and he uses it, but it's his third choice of application behind injectables and topicals. But it works well, the pellets for men who are businessmen who don't want to be bothered with coming in. They're busy. So better than nothing, as per Dr. Chrysler, the late great Dr. Chrysler, but it was not definitely one that he promoted very intently.
Mm-hmm. Okay, I understand. Thank you, Jeffrey.
You're welcome.
And now give this video a thumbs up and go watch one of these videos to learn a ton more about TRT and hormone optimization.